Hello and welcome. I'm Hussain Gandhi, the CEO and Managing Director of Affordability Center. Today we're going to be talking about an important integral part of healthcare, the pharmacist, the drug dealer. So let's see whom we can get right now. We have two guests for you today. One is Salim. He takes care of corporate governance and make sure that pharmacists run in an ethical fashion, keeping everything overboard, making sure that everything is done the right way. He has vast amount of experience in the corporate sector, which he is gracefully getting into the small businesses, the small pharmacy. I'll have a talk to him about the big picture of the pharmacy. And then we'll talk with Zarina. She is the managing director of Zcan Pharmacy. Zarina and Zcan, see, they go together, right? So she'll be talking to us about how she has inculcated those corporate governance principles and can still maintain that small business warmth, know the patients by the name, and what is she doing to make a difference in the patient's life? Let's get started. We have with me right now Salim.
Good morning, Hussain. Thank you for inviting me. It's pleasant to be here in Affordability, where well-being is very important. And I am happy to share some of the learnings I had over a period of 25 years in Canada. Pharmacies are the end of the care, where the real care begins. Doctor prescribe, but it's up to the pharmacist to provide a better care. Pharmacies are playing an important role in the healthcare, and recent changes in the regulations has allowed the pharmacies to do even some prescriptions so they can reduce the burden on the healthcare. During the pandemic, pharmacies have played an important role of maintaining the community. Even when everything was closed down, they were the only healthcare professionals available up front. Anytime you can walk in without appointment. And that's the pharmacist. Those who want to make a career in a pharmacy, this is the right time to choose a career in a pharmacy, where you have a prescribing right, where you have a relationship with the patient in a level where no other healthcare provider has it. You have visibility to their care, but the part that pharmacists need to keep all the time in their mind is ethics, doing the things in the right way. That's what I have been doing it for last 15 years at one of the major corporations. Results are not important, but doing it in the right way is very important. Ethical practice, empathy, and accountability are the three pillars of pharmacies. They don't go without having each other. So when you are providing a care to the pharmacy, make sure that you are doing it in a very ethical way. Money is not a goal, but the care is. Money is the end result of you taking care of the patient in the right way. It will come. But if you focus only on money, patient will not come back.
So Salim, you mentioned about it is the absolute best time for a student to get into pharmacy because of the newfound strength or power they have in perhaps prescribing and taking off the burden. You made important points about how this is the start of the real care. The doctor diagnoses the problem and prescribes, and now the start of the actual care starts from the pharmacist. I had a question about this. Is it a lucrative career? It's, for a new student thinking of a line in pharmacy, would you recommend that? Or I find it a bit too hard, and I find it that there are so many pharmacists around. What would you actually recommend? Should they pursue that career line?
Pharmacy is always been a good choice. It provides you convenience and not having the similar like a doctor. Doctors are working for a very longer time, but pharmacies have a flexibility of working part-time, full-time, or they can work for the extended hours. So from the career-wise, is very convenient. At the same time, is financially very motivating. The pharmacist pay at this time is very lucrative. So whatever the amount of work you have put it in your career or in school, you will get rewards very handsome. The other than that, taking care of a family from a newborn to elderly who is in a palliative care, that is a pharmacist privilege. You get to see everything. And where you, with your empathy and with your clinical knowledge, you can provide such a care that everyone remembers you by name. Pharmacists are a hero, and if you want to be part of that team, then this is the right time to choose a career in a pharmacy.
So thank you, Salim. Thank you for those insights. You said it is lucrative. Would you be able to share with how much a typical pharmacist would work and which are the different career choices and career paths available? For instance, you have a pharmacy assistant, you have other people working in a pharmacy. What is the qualification they need to have? What is the education pathway which they need to have? What are the different places? Do they have to work in a dispensary like a pharmacy, or are there any other roles which they can have maybe in the corporate sector? Can you just shed some light on that, please?
Hussein, yes, you got that right. Pharmacies is the most flexible profession you can have. Pharmacists can work in a corporation, they can work as a clinician in a hospital setting, they can work as a field pharmacist, as a community pharmacy, and they can work as a medical information provider as well. So this is a vast career. You can choose from so many things. The average salary of a pharmacist goes up to $140,000 a year. You can open up your pharmacy and you can be just a clinician. You can make handsome money. The more owners are coming out and more independent pharmacies are opening up now than it was before. The reason for that is corporations is you have to climb on a corporate ladder. But if you have your own pharmacy or you are an entrepreneur and you want to combine with something else, then sky is the limit. So pharmacy is always been paying a good handsome reward, and now it is even better than before.
So you brought up some important points. The difference between clinical pharmacy, something which is non-corporate, and then corporate pharmacy. Can you explain which are the big players involved and which are the smaller pharmacies? What is the difference between both of them? And how can you provide guidance to a smaller pharmacy to take all the good points from a big pharmacy and yet provide the care and access and availability which a smaller pharmacy does? Can you help us with that, please?
For sure, Hussein. Corporate pharmacies employs pharmacists, where bottom line is a crucial factor, and pharmacy becomes one of the corner point of a corporation, where it brings in the revenue, and the pharmacists sometimes feel like they're lost. The entrepreneurship or the ownership in a corporate pharmacy is little less compared to the independent pharmacies, where independent pharmacies are more focused on the pharmacy services than anything else. While in corporations, sometimes the pharmacists are more worried into providing a bottom line than the care. So sometimes that misconception or the misdirection from the pharmacies will stop them providing the care they need to. Sometimes some corporations, they go above and beyond, but corporations have more focus on the bottom line and the cost cutting than the independent pharmacy. Well, corporation also has another responsibility, is providing stakeholder. They are also responsible for the stakeholder financials. While the independent pharmacy, they are responsible only for themselves. So they know what to do and where to draw a boundary. So in certain circumstances, in most instances, independent pharmacies are providing a better care, but it's not a thumb rule. Independent pharmacies goes beyond, above and beyond to support the patient need, while certain limitations in a big corporations does not allow the pharmacist to go above and beyond. For example, home visit for a medication or the patient home visit is restricted in some of the corporations, while in an independent pharmacy, you are the owner. If you feel that you want to go to the home and meet the patient and provide the care they are looking for, you will just simply go there and provide that care. While in a corporation, they have to go through so many hurdles to provide that care. Nowadays, independent pharmacy has adopted a transparency and the visibility for all patients' profile through the pharmacy apps or online account that provide that in a bigger pharmacy is possible. They have the technology, but it's available in the independent pharmacy as well. So you can get the best of the both worlds by having the transparency of a bigger corporations, but the care that you are looking for or the patients are looking for or you want to provide as a pharmacist is more accessible and possible from independent pharmacy.
So thank you so much for that insight. You mentioned transparency. Now let me understand what do you mean by transparency. So if are we talking about patients who have extended healthcare and drug coverages? You're talking about what the pharmacist what the doctor actually prescribes and the pharmacist actually dispenses. Is that what we're talking about? What do you mean by transparency? Can you help me shed some light at that, please?
Transparency is sometimes a concern in a few independent pharmacies. There are some misconceptions as well as mispractices in some independent pharmacies, but we should not be drawing a parallel to all pharmacies and say that pharmacists will be doing some unethical practices. With some independent pharmacy, they provide a cheaper drug or give heavy discount by doing something they are not supposed to do, or giving them a medication that is not being dispensed or charging to the insurance. It happens. But by having a online account and you know exactly what happened in that account, then you have that visibility. You have that right to ask the pharmacist to provide you the medication history all the time. Pharmacist provides you that. So one bad person does not make the whole industry wrong, but there are many pharmacists who takes the transparency and accountability very seriously, and they provide you the care they promise you for, and you have visibility to all your medications record all the time, and you know exactly what is being charged to your insurance. So whenever you have a chance, any pharmacy you go for, ask if they have the online account available. If not, ask for your medication history at least every 6 months whenever you visit the pharmacy.
Thank you for raising this important point. I was not aware that there could be such kind of shady practices which can be going on. So if we have access to our drugs and drug history through a transparent independent pharmacy or the corporate pharmacy, it's very important that we as as normal patients who are not insiders of the industry can make sure that nothing happens which is kind of murky in their name. So that's a very good point. everybody make sure that you get transparency either online or ask them for the drugs which were actually dispensed, see whether that is in fact what was actually prescribed, and if there's any discrepancy, make sure you have a discussion with the pharmacy. Besides transparency, I'm sure that the corporate pharmacy has a lot more advantages, like pricing. Can the in Canada, can drugs be priced differently at two different pharmacies, or they are all the same, which are controlled by the government? How does it actually work out here?
Very important question. In Canada, the drug prices are controlled by the government. So any pharmacy you go to in Ontario, you will see the same price because they are all controlled by Ontario Drug Benefits. The only difference is the dispensing fee. Many corporations, they charge $12, $13 as a dispensing fee, while some independent pharmacies charge up to $9 or $8. So that's the only difference. You should not see the difference more than that. Second thing, most insurance companies pays as per the Ontario Drug Benefit. So you should not see any discrepancies in the pharmacy. Be careful with the pharmacies who are heavily discounting. But at the same time, if you have the transparency of online account, then you know that they have not done any murky practices and overcharge your insurance. So these are two important points. But above all, if you need any financial support, there are many financial supports are available for your Medicare. Especially in Ontario, there are abundance of it. So make sure your pharmacist knows about it. The first one, just to name a few, is the Salim Health. If you are spending more than 10% of your income on your medications or any medication need, you may be eligible for Trillium Healthcare. The Ontario Drug Benefits supports you on that part. If you are a diabetic or you are using any other devices, then there is another program available, it's called ADP, is Accessible Device Program. And there are many more discount programs are available. So do not rely only on the pharmacies to get the discount, but get a proper support through a proper chain of the companies or the funding members, so that you can actually live happily by having the lower cost out of your pocket.
Thank you so much that there is such kind of financial support available for the patients, and out-of-pocket costs can be contained, because we want to make sure that each and every person has access to healthcare. And if they have access to the doctors but they can't pay for their own drugs, then what's the entire point of the healthcare? So you mentioned these places where they can get funding for their own drugs. This is very important, and I think I have a hunch that the big corporate pharmacies, the pharmacists out there, they might not be looking into getting you these kind of programs, and an independent pharmacy, I feel, will be more inclined to make sure that you get access to all the different discounts which are actually available, or help which are actually available, because they actually care for the patient and you're not the bottom line. Am I right in that assessment?
Pharmacies, irrespective where they are working, in a corporation, they are more worried about pushing the prescription out and get to the bottom line. So sometimes they do not have enough time to go and look for the financial support for each and every patient they come across. In many independent pharmacies, the entrepreneurship comes out more often, especially the owners at mine, is ready to help the patient whenever they need. They go above and beyond You can find the similar cases in corporations also, but in corporations, again, the same thing. If they don't have time, they know that they are not liable for that patient. But in independent pharmacy, the pharmacies are very much up to the point that they are ready to help the patient at any given cost. And they find the resources they need to lower the cost at the pharmacy, at the patient.
Thank you, Salim. Thank you for that insight. Now, I would actually like to invite Zarina. She has used your corporate knowledge, your corporate governance knowledge, your vast amount of experience, and of the three pillars. Can you remind me what the three pillars are?
Ethical, doing the business right way, and accountability.
So, ethical, doing the business the right way, and accountability. And how she has incorporated all of these: be transparent, provide the best service to the patients, and have everything overboard, and is able to help the patients save money, out of pocket expense, and provide the best care. Let's see and get Zarina from Zcan Pharmacy. Thank you. So now I have with us the second guest, Zarina. She is a woman entrepreneur. She is the one who started Zcan Pharmacy, and I got Zcan Pharmacy within the confines of Affordability Medical Center because they were absolutely patient-centric. They told me a few things about how they go over and beyond helping the patients. I've interviewed so many pharmacists to perhaps set up shop with us, but I chose the best person. Now